I'm Beth Perrell, speaking today with Marni Stahlman. She's president and CEO of Shepherd's Hope. And we're going to talk about legislative issues. Marni, I know that you've come in and shared with us your mission before, but definitely the legislative session has some impact on what you do.
Absolutely.
Why don't we begin with the mission? What do you do there at Shepherd's Hope?
Well, our mission is very simple. We provide free health care medical services to the uninsured and underserved here in Central Florida.
And give us a sense of the scope of that. How many people are you
Sure.
helping?
Well, the scope has really been impacted, and that's why this legislative session is so critically important. So in the beginning, when we were first getting going in 1997, Shepherd's Hope in its first year of operation saw 304 patients, which at the time was nearly unheard of to have a free clinic in our community. But the scope and size now has changed considerably. In fact, since 2012, our patient volume has jumped nearly 22%, taking us from 16,973 patients in 2012 to finishing in 2014 at nearly 21,000, with an on-track number looking for 2015 at nearly 25,000.
And when it comes to the people who need that kind of help, some may have insurance, but co-pays are the difficulty, or some are just kind of in that donut where insurance is tough to get?
Well, they refer to it as being in the coverage healthcare gap. So certainly we have a portion of our patient population that is at or below 200% of the federal poverty guidelines. If you are an individual, that means you make just over $23,000 annually. If you are a family of four, that means you make just under $44,000 annually. So that's our minimum criteria, or you may not be eligible for any federal entitlement program like Medicaid or Medicare. So what has happened at Shepherd's Hope is we've continued to service the base population that we were originally missioned to do this for. Those uninsured individuals that may or may not be employed and living at that poverty guidelines. But over the years, and now certainly since the implementation of the Affordable Care Act, we've seen individuals who are also visiting our clinics for serious health care concerns who had always had a doctor, but for whatever reason has either recently lost their job or had the hours at their job reduced to the point where they no longer were qualified to receive benefits as part of their employee benefits program, or when they went up onto the healthcare.gov exchange to try to purchase the healthcare coverage. While they may or may not be able to qualify for the subsidy, which is of course based on income, many were, but the catch-all there was that oftentimes it was a $50 copay and a $2,000 deductible, and that is certainly out of the reach of many of the folks in our community. In fact, in Central Florida alone, 1 in 4 is estimated to be either uninsured or underinsured, meaning that they may have insurance access, but they either can't find a physician that will accept that plan, or in order to utilize the plan, the copay and deductible is extensive and out of their reach to afford. So it's become quite a predicament, and it's what we attribute the significant patient population surge at our healthcare centers over these last several years.
So one statistic, Florida ranks 41st out of all 50 states with the highest number of these folks that you're talking about, uninsured residents and so forth. And what happens maybe is they avoid going to the doctor and then issues become chronic?
Well, they sometimes will avoid it, or not necessarily avoid it, but not have access to it. And so, yes, you see a high degree of individuals that will come to our clinics, and they will have heart disease, diabetes, obesity, many of the same things that all of us deal with on a regular basis routinely. We try to health maintenance ourselves, but because they don't have regular and preventive or primary medical home care, someone looking after them routinely on a consistent basis, any one of those diagnoses or diseases can easily get out of control and cause other significant issues.
And before we get into the actual legislative issues, would you go ahead and tell people about the study you did not long ago where you actually asked the folks who were coming to your door, tell us about your situation?
Yeah, so we survey our patients. We survey our volunteers as well for their experience, but we survey our patients. And we have been asking the same routine questions with the additions of several new ones in the last couple of years. So we've got some good anecdotal trend data that goes all the way actually back to 2005 that asks them some very important questions, one of which is if you weren't or hadn't had a Shepherd's Hope clinic available to you, where would you have gone for your health care service? And the predominant number of those respondents cited going to the emergency department. And that certainly is sometimes not only not the most appropriate place to get care, but it's certainly also the most expensive. So that was pretty significant. The other questions that we implemented over the last couple of years that have come out in the survey is, when was the last time you had health care coverage? And nearly 18% of our respondent pool indicated that they had had their coverage and lost it within the last 6 months to a year. So that's a very new individual entering what we call the safety net of services. Those are individuals that may have already or always had some sort of primary care or routine medical care, and now are finding themselves having to seek services at a free clinic like Shepherd's Hope, and for the very first time come and ask for help. It's something very foreign to them. So those two are questions themselves, and how they responded became some key indicators that we've used to message out to our community partners and the community at large how important it is for an organization like Shepherd's Hope to be sustained, and why it's important for our patients for us to be able to care for them.
So you don't see any lessening of the number of people coming in, right? It's
no,
just an increase?
Beth, we haven't. It's been an actual increase. And as I said, it's forecasted for our next year, 2015, for that to continue to climb. And the reason for that, and maybe that's where we launch off, is what's currently happening as recently as this week with Senate Bill 7044 and a lack of a companion on the House side to take up healthcare expansion in Florida.
Okay, so why don't we turn to that? So to explain to us what's going on in the legislature, what you'd like people to know.
Well, what I think the most important thing that I'd like people to know is that this is a real turning point in the state, and for the legislators that we elected to do something for nearly 1 million people that, if they were to pass healthcare expansion, would find themselves covered and available to receive healthcare benefits and services. It also is tied right now to the Senate, who has, through its leadership, taken up the task and has passed it unanimously out of 2 committees as recently as this week. And as I indicated, the House side is lacking a companion bill. So we're faced with the legislature scheduled to come to a close on April 1st if they don't go into a special session. And at the trajectory that we're headed, it doesn't appear that the House is going to take the issue up. And that is going to be catastrophic, because it will be the one and last chance that Florida has to possibly pull down nearly $52 billion in federal funding that can help to create a state exchange where people can go and, like the healthcare.gov site, purchase benefits and get access to care. It's extremely frustrating for community advocates like Shepherd's Hope, where we like to say we're the voice of that 1 in 4 that is asking for the votes on the House side to take up the issue and debate it. It's got a wide array of very disparate collective groups that have assembled to endorse it that you would normally never see come together. Everything from the Florida State Chamber of Commerce and the Associated Industries of Florida to the Florida Hospital Associations to advocacy groups and providers like Shepherd's Hope, all saying the same thing, which is it's incredibly important that healthcare expansion take place here in Florida so that we can provide coverage for at least 1 million additional people and not lose the $50 billion that comes with accepting the expansion and creating the state exchange.
So speak to some of the questions I know you hear people ask about, well, what would be the benefit to us if we do expand this? I have insurance. Why would I care about the millions having access to this?
Well, one of the simplest ways to answer that question is the average emergency room department admission in Central Florida. The Orlando Business Journal came out with these numbers back in November, they estimated that the average admission into an emergency department in Central Florida was about $4,600. Well, if you're an uninsured patient, that money and that cost has got to go somewhere. And what is important for folks who say, well, I have insurance and why should I care if someone doesn't, is that the system is going to have to make that up somewhere, and it's cost shifting to individuals who are then ultimately going to be asked to pick up the burden. They'll see their premiums rise. They'll see their co-pays and deductible rise because the insurance companies need to get paid and the hospitals need to provide for their care and service. It's a cycle that I wish we could get out of. It has to do with how we've allowed the health care coverage issue to be impacted by fee-for-service and incentivized for fee-for-service instead of fee-for-health, which I'd like to see. So the simplest answer is why you should care if you have and someone doesn't is because at some point it's going to arrive back and impact you, and it is.
So given all those disparate groups you said have come together in support of this kind of thing, surely somebody's been crunching numbers like that. Are there some studies or some data out there about...
There's a great deal of information that has, and I think that's where you see where the Senate leadership has been comfortable on a bipartisan position to unanimously pass their version of the bill out of their two committees. There's been no dissent, regardless of political party, about the efficacy behind the program and some of the values that it would be able to restore and bring immediately to the state when it was finally implemented in late 2015. What I think has been relied upon are some false assumptions and some proven arguments that have been shown to not be accurate. Easier to go back and try to create something from nothing and, you know, smoke and mirrors and look over here than face the reality of what really is the truth about the program and what the expansion will really do here.
Do you want to speak to some of those myths?
Well, I think some of the myths is that, you know, the state is concerned, or as I've come to understand, some of the legislators on the House side are concerned that while the federal government is promising that a certain amount of monies will flow down in that first year, there's no guarantee that that money would continue, and that's not true. So they've gone back and kind of, you know, tried to say that there's a wolf crawling around in the garden and the federal government is not to be trusted in terms of holding up their end of the bargain if the state were to go down this road. But there's no indication that that has happened in other states where they've accepted expansion and the government has fulfilled its end of the bargain in terms of setting up the exchanges and supporting the initiative in that state.
So for those of us listening, what would you have us do now?
Well, I think the best thing that I could advise anybody to do is find out how to get in touch with your local state representative. Your state senators have already endorsed it. And if you go to myfloridahouse.gov, you can find by district and zip code and street. If you don't know who your state representative is, get on the phone, email. You need to make your voice be heard because it's not just about going up to Tallahassee and knocking on that legislator's door and beseeching them to take it up. It's about them needing to hear from the constituents that elected them, that this is what their base of voters that they represent want them to do.
And I have to ask you, I know you spoke to this, but I just want to make sure I'm clear on it. So this is going to happen right away, hopefully by April 1st, unless there's a special session. What happens if not? Does it take another year, or can it be considered again in a year?
No, this is it.
This is it.
This is it.
Because of the federal government deadlines.
Correct. Because the government has said we've given you extensions. And there's another piece to this that is playing out in the background simultaneously, two other pieces actually. One is called the low-income pool. That is a pool of dollars of about $2 billion that comes down to the federal government, from the federal government to our hospitals to pay for the low-income uninsured folks that do actually come to the emergency departments and offset those costs. That money is set to expire and not be renewed at the end of April, I believe it is. So there's that simultaneously. And then there is a Supreme Court case that is currently under review with a decision expected in June. Oral arguments were heard several weeks ago in a case called King v. Burwell. And in that case, the plaintiffs are arguing that when the Affordable Care Act was written, there were four words in the bill that pertained to the use of the word states and how it was interpreted. The ruling could, in fact, take away the ability for subsidies to be granted to states that currently utilize the federal exchange. If that were to happen, 8 million people that are currently covered under the Affordable Care Act through products they purchase through healthcare.gov because of the availability of subsidies would go away. So you kind of have a perfect storm, and I have said, April 1st is not a joke, or maybe it is, and it will be on us if our legislators don't take this up.
Well, Marni, it's always good to talk to you and get an update. What haven't we touched on that you'd like to talk about?
Well, I would like to issue an invitation, if I could. On April 9th at the Church Street Ballroom, starting at 8:30, we will host the annual Call to Hope event for Shepherd's Hope. This is our opportunity to invite community members to come and for 1 hour experience a moment of hope where we present a particularly inspiring story of a patient that we took through and they took us through a journey in the previous year, and how through the array of partnerships and supports that we received, what the end result of that was. It's an incredibly inspirational morning. It doesn't cost anything to attend. Breakfast is free. You might have to fight a little bit to get to downtown parking with some of the I-4 construction, but we promise we're doing our best with that. And if there's any leaders listening out there or community members that would like to attend, they can call into Shepherd's Hope or go to our website. There's a link to register and RSVP right to the event online.
And in terms of every day, how can people learn a little bit more? And I'm sure some people are listening would like to visit you and get some help.
Yes, they can come or they can call direct into our office from our website and talk to our administrative team here, where we can try to direct them to the clinic that's located closest to their needs, and also where, if they're calling for a particular specialty care need that they have, we can direct them to where they may be able to find that specialty provider on that particular night. So they can find us off of the web, or they can call in directly at 407-876-6699, and that will take them in through the front portal, where someone will be happy to assist them to try to get them some direction about where they should be going that night or perhaps the next.
All right, Marni Stahlman, good to talk to you again.
Thank you, Beth.
Marni's with Shepherd's Hope. I'm Beth Perrell.